Fever is very alarming to parents because it does usually indicate an infection. But the good news is it's usually a viral infection. Viral infections are usually self-limited. There's really not anything you usually do to treat them other than let time run its course and the body fights off the viral infection. There are some notable exceptions though, particularly for younger babies. If your baby is less than 3 months old, you treat fever as if it may be an indication of something more serious. You have to treat it that way. So if your baby is 3 months or less and they run a fever, fever is defined as 100.4 degrees Fahrenheit. If they have a fever above that, then you need to treat that like a medical emergency and take them to a doctor. And if they're less than 3 months of age, they will probably initiate a workup that would include blood work, probably urine, probably a chest x-ray, and possibly even a lumbar puncture. And that is to rule out any bacterial cause of fever. And fortunately, about 95% of the time, or maybe even greater than 95% of the time, the workup will be negative and it will just be a viral illness, just like in older people. But the signs in younger babies are more subtle sometimes for a serious infection. So a larger workup is warranted. Now, that full workup that I mentioned will always occur if the baby is 1 month or less. That is the standard workup. Sometimes that catches people a little bit by surprise. Their baby just has a low-grade fever. They have this huge workup that often the ER doc is telling them about. And so that's one thing I always inform my patients about. If your young child has a fever, then we'll do everything to track down the source and make sure it's not anything serious.